Good afternoon, everyone. Welcome to breakout session number 3 on teledentistry, a path to improving oral health equity. We thank you all for joining us. We're really excited to have you here. Okay, so this session will include 2 presentations from Dr. LaTedra Collins and Dr. Douglas Cross. My name is Lisa Staples, and I will serve as the moderator for this session. Throughout the presentation, questions can be submitted at any time through the Q&A feature or the chat. We will answer all questions during the Q&A portion of the session after the speakers finish their presentations. And now, without further ado, we will begin today's presentation.
Thank you. Again, I am Dr. LaTedra Collins, and I will begin. I am so happy that we are here in the forefront as one of the states allowing teledentistry. Believe it or not, teledentistry, telemedicine, was developed to treat astronauts in space long before COVID-19. Telemedicine was a part of the standard delivery of care. By the end of April 2020, telemedicine visits skyrocketed to nearly 1 million visits per week. Reducing health disparities brings us closer when we all reach for health equity. Teledentistry is important as a path to improving oral health equity. Next. Let's define teledentistry. The American Dental Association defines it as the use of telehealth systems and methodologies in dentistry and not service itself. And it has a role to expand care beyond normal circumstances. It has 2 codes, D9995, which is a real-time video conferencing live interaction code, or code D9996, asynchronous remote, which stores information and forwards it to a provider or practitioner for later use. Then there is mobile mapping, mobile health, using personal devices, as some providers did in the initial stages of COVID. Thanks to the Office of Civil Rights, HIPAA penalties were removed for such emergencies. Teledentistry captures X-rays, extra and intraoral photos, similar to the ones we've seen at orthodontic visits, and charting of periodontal disease and teeth, and some even have 3D scans available. Wherever the patient is located is considered the origin site. The location of the provider or dentist is considered the distant site. And it is possible to have a patient presenter at the origin site. So if you can imagine places like nursing homes and hospitals where patients may be incapacitated, there is a nurse or some provider there that is the in-between, the bridge between the origin and the distant site. Next. Before you log on, know that there are risks and benefits like anything. The benefits are the ease of tracking referrals, increased access to care, oral health education, and management of complex patients. The benefits, I believe, outweigh the risks. However, cyber attacks are real. Internet access is a problem for some in rural areas, or because they are not familiar with such technology. For providers, we are still unsure of how and when we will be reimbursed. Does your EHR or electronic health record integrate with teledentistry? Please, please, please document all visits. This is still a form of practicing dentistry, and malpractice is real. The actual visit is the smallest part of teledentistry. However, training your patients and staff is the biggest. As we proceed into the future, this changes your workflow for your practice, which means new roles and responsibilities for your staff. The DEA states a prescription is issued for legitimate medical purposes by a practitioner acting in the usual course of his practice, his or her practice in teledentistry. So secure your information. What could go wrong? A lot could go wrong. Without proper security controls in place, a provider's conversation or patient information could be hacked and end up on Google search. Please, please review your insurance coverage, your malpractice coverage, because all the rules of medicine still apply, even lawsuits. Next. There are all kinds of resources. As dentists, we should definitely be checking at the national level first. The American Dental Association, you should visit their website for information about teledentistry. There is the American Teledentistry Association, CMS, and one of the dentists I'm proud of in the state of Missouri, Dr. Nathan Sutter, has a program called Mouthwatch, which is where I learned a lot of my information from. The National Network of Oral Health Access, and of course, I've attended webinars with the National Dental Association. Also, it is important to check with your state board. The DEA, Drug Enforcement Act, has guidance also on their website. Next. So how do we implement in the state of Louisiana? Well, we have an amazing trailblazer, Dr. Douglas Cross. Thanks to his hard work and that of others, Louisiana teledentistry rules were published last month, and we can now use them to implement equity in oral health. We have big changes on the horizon in the state of Louisiana. Thank you. Next.
Thank you, Dr. Collins, for all that you have shared with us. I really appreciate it. I think between earlier's presentation and just now, I feel like you have really just educated us all and have really just been wonderful today. So thank you for that. Our second presenter is Dr. Douglas Cross. He is the dental director and dentist at EXCELth Incorporated in New Orleans and is the dental triage lead for the Louisiana Mission of Mercy. Okay, I'm going to go ahead. Thank you, Dr. Cross, for being with us today. Oh, you're on mute. Oh, still on mute.
Can you hear me
there
now?
We go.
Okay,
Yes.
great. Good afternoon, everyone, and thank you for inviting me to speak. Next slide. Louisiana is a unique state, and I think the state capital expresses its uniqueness more than just about anything else. Since its dedication in 1932, it's been a symbol of pride, history, and the spirit of Louisiana. As most of you know, it's the tallest Capitol building, and it's not a rotunda with wings like most state capitals. And it was built to symbolize the end of political domination by the wealthy and socially connected, of course, during the Huey P. Long administration. At the top, there's a 23-foot high lantern. And I would like you all, when you look at the state capitol, to think that it symbolizes our struggle to improve the oral health equity throughout the state. Next slide. The old state capitol wasn't without controversy either. Mark Twain called it pathetic. At times, I wonder if he ever went inside the building, because to me, it's gorgeous, and it's probably the best example of Gothic revival in the South. Mark Twain, of all people, should know not to judge a book by its cover. Next slide. We certainly have a unique culture, and it's known throughout the world. I travel a lot, and when I tell folks I'm from Louisiana, they all have a short list of the places they want to visit when they come to the US, and New Orleans seems to always be on there. Mardi Gras, of course, there's top of the list of what people know about New Orleans. I think this year's Mardi Gras was more like the slide on the right, Chicago, than on the left, because of the obviously very cold weather and COVID. Anyways, we're also known for our music and architecture and the food. Oh my God, the food. We have trouble with obesity, we have trouble with diabetes, and of course the food certainly contributes to that. Next slide. Anyways, this year we're the #1 unhealthiest state. Some years it's Mississippi. So this year, Mississippi's probably saying, thank God for Louisiana. And maybe next year it'll be Louisiana saying, thank God for Mississippi. But we're always out at the bottom. Next slide. I don't think we really have to be at the bottom, but there have been some efforts to elevate us. Oral health inequities have been here for a long time, as evidenced by this slide. This was taken in the 30s, shortly after probably the Capitol was built. And these are mobile dental units, which is very cutting edge for the 1930s, and it offers free dental care. And look, there's at least 6 units there. I don't know how long this program lasts or what it actually accomplished, but it's very interesting to see that we have tried on other occasions to take care of these disparities. Next slide. Anyway, Dr. Collins said, the #1 unmet health need is dental care. Next slide. One of the problems that we have is we have the fewest dentists per capita in the country. And those dentists tend to be concentrated in urban areas. So like New Orleans, Baton Rouge, St. Tammany Parish, Lafayette, Shreveport, all have more than enough dentists. However, in rural areas, we were really lacking. And this situation is getting worse because most dentists in rural areas, or the majority now, are 5 to 10 years away from retirement. And then from my sources, I'm hearing that it's very hard to sell practices in rural areas. So just graduating more dentists is not going to help. We're not going to get more people, significant amount of more people in rural areas just by graduating more dentists. So we have a very complex situation. Next slide. And the real tragedy about dental disease, it's preventable. So I think we need to concentrate on that prevention part. Next. Albert Einstein said, insanity is doing the same thing over and over again and expecting different results. Honestly, if we keep doing the same thing, we're going to end up the same way. So we need to do something different. And I think that difference is putting more emphasis on prevention. Another definition of insanity is getting a mad scientist wig, going to a Halloween party and expecting to be a genius after you put it on. Next slide. Anyways, you know, an ounce of prevention is worth a pound of cure. Everybody's heard this. Well, certainly makes a lot of sense. Here we have prevention like sealants and fluoride, which is certainly easy to do and inexpensive to do. Yet we have people that lose all their teeth. Now, luckily, we're not the worst state. I think West Virginia is the state with the most edentulous people. So at least we can say thank God for West Virginia, but we're up there. And now the adult denture program, they pay very little money. In fact, you could hardly get the money to pay your lab work for dentures. So we're going to be working to get more money to replace people's teeth, because that's a big thing. It's a quality of life issue for seniors. Really, if I was going to rewrite this, I would say an ounce of prevention is worth a ton of cure. Next. Anyways, if we have 100 children, about 50 of those kids would get cavities if you didn't do any sealants. But if you do sealants, you're going to get only 12 children on an average that have caries. That's a 76% reduction. Now, it's so easy to do sealants. Why would you not do sealants? Next slide. A lot of dentists won't do sealants because they're worried that they might seal in decay. This attitude is actually not backed up by science. Now we have articles that say that if you seal in caries, that the caries won't progress in 71% of the cases. So if you have a cavitated lesion, of course, you got to, like the ones on the right, you're going to need to restore it, and only a dentist can do that. Next slide. But we need to do sealants in as many children as we can possibly get to. So next slide. So teledentistry as a way to achieve access to care. It was an incredible win in Louisiana. If you notice this is what hygienists are allowed, procedures are allowed to do. Well, we're in the South. We're very conservative in what we allow hygienists to do. But states on either side of us, like, excuse me, sorry. States on either side of like Texas and Mississippi are also very conservative. There's a few states up north that are still conservative, like New Jersey, for instance. They have very little that a hygienist can do independently. But that's a state that still doesn't allow you to pump your own gas. Okay, so we've done really well with this. Next slide. So I'm going to talk about the access to care with the new teledentistry rules. So hygienists are going to be able to perform prophies, sealants, and fluoride varnish and take radiographs under supervision of a dentist via teledentistry. So the dentist does not have to be physically present. Next slide. The dentist, in fact, could be anywhere, but he has to be licensed to practice in Louisiana. So this means that while we have a surplus of dentists in urban areas, they can actually be serving kids in North Louisiana. Next slide. So in order for a hygienist to do this, she's going to have to be employed by a federal qualified health center, or he or she has to be a governmental employee, or work for a nonprofit that's not receiving any compensation. Next. So where can it be done? Well, public schools, public elementary or middle schools in which 50% or more of the students are economically disadvantaged, that's in a parish with a health shortage area or HIPSA score above 15. Now, this was done to prevent this program from occurring in urban areas, which would be which a lot of dentists would probably object to. Also, FQHCs are having a difficult time filling positions in North Louisiana. So we will be able to use teledentistry to help fill in the voids, some of those vacancies. Next. So what parishes qualify? Well, typically the top of the boot. Yeah, next slide. So the next step is to create sustainable programs because we still need to get properly reimbursed by Medicaid in order to make a sustainable program. Next slide. And one of the things that we need to do is get reimbursement for a screening code. If we do that, then when we need to refer a patient, then the dentist would be able to get paid for the exam, which is a significant amount of money, particularly in Louisiana. Also, it's going to be more efficient. Hygienists will be able to see patients faster, and there's not going to be any duplication of effort. In other words, 2 treatment plans. Next slide. So the session can be synchronous or asynchronous, but the dentist will need to review the records before the patient's dismissed. Next slide. So I'm going to go over a little bit about the equipment that's needed. Now, ideally, it would be great to have mobile units, but they tend to be very expensive and very expensive to maintain. So sealants can be easily done with using portable equipment. Next slide. The ideal situation, of course, is to have a mobile unit because you can do any procedure and it can be done easily. It can be done pretty much like in a dental office. This dental unit that's pictured was designed by me after Katrina. Next slide. Anyways, I think probably the best chairs are going to be your American-made chairs. They are expensive, but then there are deep discounts. Now, the Chinese portable chairs I've never used, but I imagine them probably be superior to other things like lawn chairs, massage tables, and such. I've used lawn chairs and massage tables. They are adequate. No, you don't need a barbecue pit, but I just put that in there for a little laugh. As far as the lights go, you probably can use just a headlight. I think that's more than adequate. I would bring spare batteries and a spare headlight, but they're very inexpensive. Portable dental systems, those can be pricey, but then the Chinese do make some models that probably more than adequate. Some have compressors in them, some don't. Make sure you decide how you're going to get compressed air and make sure you know how you're going to deal with the noise of a compressor. Next slide. X-ray systems. I really do like the Nomad. I know it's safe, it's easy to use, and they're dependable. There are some imported portable X-ray systems. I have used those. Some of them can be slightly problematic. I'm not sure about the safety issues. Always, before you start using a portable X-ray unit, make sure the staff is well trained because you can get more radiation than you're used to in a regular dental office. Intraoral cameras, there's a huge price range. I just bought one and used it. It was only about $50 and it worked very well. And it's not like the $2,000 that you may have to pay for another camera. But you have to make sure when you buy these that they do work on your operating system, because some only work on older operating systems. Next. We have a problem in Louisiana with dental hygienists, particularly in North Louisiana, and COVID has compounded this. I just learned this week that nationwide, 8% of the hygienists are not practicing because of a COVID-related problem. I hope we get these hygienists back, but that certainly could create even a greater shortage than we already have. So what we really need to do is work on educating more dental hygienists, and we will be working on that. Next slide. So in order to deliver quality care, you're going to have training, calibration, and peer review. I've seen this done in Healthy Smiles of Orange County, and it's very impressive. So the visit that the child gets can be equivalent to one that a dentist sees the child personally. Next slide. So a COVID-19 world even makes sealants even more attractive. Obviously, instead of having to use a high-speed handpiece to drill out decay, we're just putting sealants on it, not so invasive, not so many aerosols. Another thing to consider is that I just learned this week that nationwide, this survey determined that 10% of the dentists are no longer accepting Medicaid because of COVID. Next slide. And we all need to work together. And I've always said it's much more than just teeth. It's children not missing school because of toothaches, children being able to concentrate in schools, children able to be children, able to play, not being burdened by toothaches. And of course, kids have self-esteem problems too, with missing teeth and with decayed teeth. And we need to address these issues. Every child needs to have good oral health. Also, we don't have adult dental benefits, not much to speak of in Louisiana when the child reaches 21. If they need dental work, the economic burden, according to this one study, for a poor person is 10 times what it is for a middle-class person. So many times, someone has a lot of dental work that needs to get done and it never gets done. People miss promotions for their job because they can't get their teeth fixed. People don't do well in job interviews because their teeth look bad. There's a lot more to oral health than just teeth. So, well, thank you all for listening. If you want to email, here's my email address, and happy to entertain any of your calls too.
Yes, thank you, Dr. Cross, so much for sharing all your knowledge and expertise around teledentistry. And thank you, Dr. Collins, as well. I think both y'all are just sharing. It's just an exciting new future for Louisiana, being that teledentistry is under the Dental Practice Act is allowable in our state. So it's very exciting. So now we are opening the floor to any and all who would like to ask any questions. We have the questions can be submitted through the Q&A box or the chat. I am looking at both. I am not seeing any questions at this point. Anybody has anything to share? If not, that's okay too. Even like a good job or a thanks for coming. But yeah, that's okay. All right. Well, we are going to move along. If you do have any questions, you still can submit them. Thank you, Annette. Good job. Okay. Thanks for all this information. Yes, Celeste, for sharing that as well. We are excited to share all the great work that is happening. Okay, so our next ask of everyone is going to be around the evaluation. The evaluation link has been put in the chat for everybody to see. Y'all can go ahead and click the second link, the evaluation link. We really want to know what you thought of today, what your, what the big takeaways were. We really just want to take some time to hear what you have to say. I'm going to go ahead and share the survey. This is what it'll look like. It really isn't too long. I know there's another page, but either way, really take the time to provide your feedback so we know for next summit what went really well, what we could improve on, so we can learn how to prepare accordingly. So really take the time, go ahead and check out that link. Okay, great. And now moving along, we have our summit resources. I know in early morning, I shared the website, the Louisiana Oral Health Summit webpage with y'all. That's the first link that Joseph shared. Make sure you go and visit and you see all the wonderful resources that were highlighted in that on the webpage. I know you can see all the information for our guest speakers, particularly though there were a couple of documents that were referenced in our morning sessions. So you can see the open recorded updates there that Celeste Terry and I put together as state and grassroots representatives. You can see the Louisiana Oral Health Coalition State Action Plan, our report card that was referenced, and an updated dental HIPSA map, just other related resources that are relevant to the conversations that we had today. So really go take some time and check them out to learn more. Okay, and then this is the contact information of those that are involved, the contact information for the Louisiana Oral Health Coalition, the email and website if you want to check it out and learn more. If y'all aren't members of our Louisiana Oral Health Coalition, just shoot off an email and let us know. We'd love to have you join. Because we think this is where we can continue the conversation. The Louisiana Oral Health Coalition, it started, Michonne shared our history and everything, but the officers and everybody that's part of the group, we have a listserv and we share just relevant resources and related announcements around oral health. So that can be your outlet within Louisiana to learn about what's happening. So join the coalition, get involved, so you can just stay in the loop around oral health. We really just want to take this time to thank y'all for being with us. I know it's a 1:05. I have no questions or anything. So I think we'll end the day a little early for y'all, get a few minutes back. But on behalf of the Louisiana Oral Health Coalition and Well Ahead Louisiana, we would like to thank you for joining us today. This breakout session concludes the 2021 Oral Health Summit. We hope that this was a day you will remember, and let's put our seatbelts on and brace for the ride. The road ahead is full of challenges, but just as many wins. Thank you for investing in our plan to achieve better oral health access and equality for every Louisianian. And we will see you all at the next Oral Health Summit in 2022. So thank you all for being part of this journey today, and we hope you thoroughly enjoyed it. Again, fill out that survey so we can hear your feedback. Really appreciate the opportunity. Thank y'all so much. And yeah, love the ride. Thank you, Celeste. Yes, thank you all. And we'll hang on for a few minutes if there are any other lingering questions. But otherwise, y'all are free to go. Thank you for staying on and learning about teledentistry and all that Dr. Cross and Dr. Collins shared.